Okay.
Okay, morning. My name is Shazia Khan, and today's session that we'll be doing is 4.16 Communication Skills for Health and Social Care Management. And today we'll be doing Learning Outcome 1. The aim of this unit is we're just going to go through the module spec with you. So the aim of the unit is to develop your knowledge and understanding of communication, both with colleagues in health and social care organisations and with service users. Learners will gain an understanding of why communication is sometimes ineffective and the skills needed to overcome difficulties. Learners will demonstrate a range of communication skills, including carrying out an oral presentation to colleagues and a face-to-face consultation with the service user and formal written communication. The unit level is number 4. The unit code is H5037156 and the credit value is 15 credit values. The unit grading structure is a pass, assessment, guidance, so assessment and guidance with the awarding organisation guidance. So there are 5 learning outcomes. The first one is to understand how internal communication takes place within health and social care organisations. And the assessment criteria is the learner can look at 1.1, which is to explain the process of communication within health and social care organisations. 1.2 to assess the appropriate use of different modes of communication for different purposes. Then learning outcome 2, you will be looking at understanding the factors that impact on the effectiveness of communications. And you'll be looking at 2.1, which is to assess the impact of personal relationships on effective communications. 2.2 to assess the impact of non-verbal communication on oral communications. 2.3 to analyse the factors that impact on clarity of communication. 2.4 to assess the impact of technology on oral and written communication. And 2.5 to review the use of conventions in written communication. Then in learning outcome 3, you'll look at understanding the features of communications between health and social care professionals and service users. You look at 3.1, which is to evaluate formal communication methods and systems used by health and social care organisations to communicate with service users in a range of contexts. You look at 3.2, which is to assess the communication skills needed for face-to-face consultation with service users in different contexts. You look at 3.3, which is to analyse the issues of confidentiality relating to communication with service users. You look at 3.4, which is to summarise the additional skills needed by health and social care professionals to ensure effective communication with service users. And 4, learning outcome 4 is to be able to present oral information effectively in a health and social care setting. You need to look at 4.1 to design an oral presentation for an internal audience with a health and social care organisation. Use technology to support the presentation. 4.3 to carry out a consultation with the service user. 4.4 to present complex information orally. And 4.5 to assess effectiveness of own communication. Then we have the final learning outcome, which is learning outcome 5, and that is to be able to communicate formally in writing in a health and social care setting. And we look at 5.1, communicate complex information for specific purposes. 5.2 to prepare for a document and a meeting. 5.3, convey qualitative data using charts and graphs. And 5.4, review the written communication. So these are the learning outcomes that we need to look at. And this is a little bit about the module, what we're going to do, okay? So we've got 5 learning outcomes. So we've got learning outcome today is learning outcome 1. Tomorrow is learning outcome 2, and then Sunday is learning outcome 3. And then we've got 2 more learning outcomes next week, and we've got the assignment discussion as well. Okay, have you got any questions?
Yes. When shall we look at the remaining 2 outcomes? Is it possible possible to look at them before next weekend?
Which learning outcomes? We're looking at learning outcome 1 today.
Yeah.
And then tomorrow learning outcome 2. And then Sunday learning outcome 3. And then next week, Friday, learning outcome 4. Saturday learning outcome 5 and 6.
So what I'm asking is it possible to look at what learning outcome? Let me see, 1, 2. Is it possible to look at learning outcome 4, 5, and 6 before next weekend? So that next weekend we are looking at another unit.
Okay. I don't know if you can do that. Have you asked Jill if you can do that?
Okay, no problem.
Maybe if you ring up, and if you want to do that, we'll try and do that, but you need to ring them up because they've arranged it for me like that. So if they want to arrange something like maybe 2 sessions tomorrow or something,
yeah, that would actually be good. Maybe we could do 2 sessions tomorrow.
Yeah, but I think we need to speak to one of the tutors. So who did you contact? Was it Jill?
I did not contact Jill, but the person that I talked to contacted Jill, and Jill sent the schedule. But let's look at that after the lesson for today.
Yeah, we'll look at that after, okay? So let's start with the session. So we're looking at learning outcome 1 today. And learning outcome 1 is to understand how internal communication takes place within health and social care organisations. So the learner will understand how internal communication takes place within health and social care organisations, and the learner can 1.1 explain the process of communication with health and social care organisations, and 1.2 assess the appropriate use of modes of communication. Now, when we look at communication, and it's really important to identify why is communication so important in any organisation, and then we'll look at the health and social care. Why do you think communication is so important? What do you think?
I think communication is important. Firstly, it's a way for us to share information, to get feedback, to build on relationships.
Yeah, it's so important. And we look at 1.1, explain the process for communication within health and social care organisation. And what is the process of communication? So the communication process, and the definition is that communication is a two-way process. Okay, so between wherein the message in the form of ideas, thoughts, feelings, opinions is transmitted between 2 or more persons with the intent of creating a shared understanding. And within the health and...
Interrupting you.
Yeah.
I would like to, let me just put forward my opinion. I have gone through these handouts on my Moodle. For example, this one that we are going through, and I feel like it's not detailed. I feel like it's not detailed enough. I feel it's not detailed, especially according to this question of explain the process of communication within health and social care organization. So I request that as we go through this session, maybe you could add in some things in that.
Yeah, we will add in, but the problem is you need to do your own research as well.
Yes, I get you.
Yeah. So that's what we're going to do. We're going to add in some stuff, but you also need to do your own research to do the assignment area as well.
Yes.
Okay. So when we look at communication and we look at why it's important when someone is giving care, if you're giving care to a person, or maybe an elderly patient, Yeah. What does it enable you to establish? Good communication, what does it enable you to establish? Does it, when we talk about it's a two-way process between you or two or more people, if it's a patient and you, what is communication process there to establish? If you've met the person the first time, okay, if you say patient, for example, Vanessa, if you've met a patient for the first time, if you have good communication skills, yeah, what does it enable you to do? Hello, Vanessa? Can you hear me? Vanessa? You not hear me?
Yes, sorry, I reached a point where I couldn't hear you. May I please
Okay.
get your question? Because I haven't
So
been
if
here.
if you meet a patient first time and you know it's just the first time, what are you trying to do when you talk about the communication process between two people?
If I meet a patient for the first time,
Yeah.
of course, first of all, the way I present myself, first of all, will speak a lot to the patient even before I get to actually speak to them.
Do you try to establish any sort of relationship with that person?
Yes.
Yes. Yeah, so if you are looking at the communication process in health and social care, it also enables healthcare providers to establish any sort of rapport with that patient, and solicit any sort of crucial information from that patient and work effectively with the patient or other members of the public. So you have to establish a good relationship. It's a process of fully attending to another person using both non-verbal and verbal cues in order to check their understanding. And, this requires you as a healthcare professional to listen, doesn't it? That's one of the skills that's really important, listening. So it allows you to, understand the client. It allows you to, understand the patient. And it allows you to, if you have good communication skills, they have a positive effect on health outcomes. Patients and those important to them want to know about the participant in their own health. And then if you're communicating with doctors and other nurses, you have a different way of communication. So it's very important that you have a shared understanding. So 1.1, explain the process of communication within health and social care organizations. The dynamic process. Communication is a dynamic process that requires ongoing assessment of whether the message has been received accurately. What do you think that means? What do you think that means?
The dynamic process.
Yeah,
You
the
mean the
dynamic process.
dynamic
It says communication is a process that requires ongoing assessment of whether the message has been received accurately.
According to how I get this,
Is it here where the person keeps telling them about communicating the message to them all the time so that they understand?
okay.
So, for example, excuse me, if I'm talking to you, Vanessa, if you don't understand something, I'm going to tell you the message again, to make you understand. Yes?
Right.
Yeah. So if I give you the message again, I'm going to make sure that until you understand the message, I'm going to keep telling you what the message means. Yes?
Yeah.
Yeah, so it's going back and forth. So these are some strategies include paraphrasing, asking and clarifying questions. So if you are asking someone something, you want them to clarify it again and again. And reading body language. Why is it important to read someone's body language?
Because someone may actually say something and yet their body language is speaking something different.
Excellent.
So actually body language helps us to actually get that truth out of someone, like that true meaning.
Yeah.
Actually meaning yes. Or
give me an example of your body language. Give me an example.
an example. For example, if someone is talking to you and
Yeah.
they are conveying a message of maybe appreciation or thanks, like a positive message, but then their body language, for example, they are holding their cheeks,
Yes, yes.
they
Yeah,
look frown, like their face is a
yeah,
little bit frown, they're laid back on their chair, they're not sitting
yeah.
upright.
They're
So
ignoring you. Yeah,
they're trying to give is totally different from what their
yeah.
body language is speaking. Yeah.
The body language might be that they don't care. They just, sat there listening. That's it.
Yeah.
So the body language does play a big part in a conversation. So dynamic processes with the conversations is a back and forth with each person talking about 15 seconds. It also emphasizes that you're paying attention to little detail beyond the theoretical how to communicate. For example, the way you hear the words and listen seem to convey the same thing, but are two different things. Like we just said about the body language, the way you convey a word might mean two different things, and they are two different separate things. So the communication process is a dynamic process. It is there to convey thought or feeling to someone else. It is there to convey how it is received, depends on the set of events and the person exposed to it, and how you say plays an important role in communication. So communication in any organization, not just health and social care, is really, really important. Explain the process of communication within health and social care. So we have the sender, okay, and they will state one idea at a time so that you understand, okay. The reason the sender will be sending a message so is that you are able to understand it. State one idea at a time. State ideas simply, so make it simple, make the language simple, because the other person may not understand slang or any sort of jargon. Know your audience, so know who you are sending the message to. Explain when appropriate, and repeat if appropriate, and encourage feedback. The message here is speak and write clearly. Use correct terminology. Why is it important, Vanessa, to use correct terminology?
To avoid mixing up of different terms, like different people may have different people may have different ideas or different perceptions of one given term. So yeah, that's how I get it.
Yeah, so you have to make sure that you're using the correct terminology. So the person sending it to, if you're sending a message, for example, Vanessa, to a patient, will it be different to you sending a message to another nurse or a doctor?
Yes, it will be different.
Yeah. Why are you trying to, sometimes you are using basic English for the individual, the patient, to understand, and then sometimes you are using words that they don't understand to nurses. So nurses will understand them, but patient won't understand them words.
Yeah.
Use appropriate vocal and tone and volume. Why do you think it's important to use the right volume and tone?
Why is it important?
Your tone of voice, does it impact on your communication skills or your listening skills, your tone of voice?
Yes, it really does. especially to the person receiving the communication. It really does. The voice, the tone of the voice really matters a lot, because it either tells if you're angry or you're happy
Yes,
or you're
exactly.
passive,
Yeah.
or yeah, one of
Yeah.
those.
An example would be, Vanessa, when I'm teaching my students and they all start coming in late into the class, I show that my tone of voice goes louder because I'm angry at them because they should be coming on time. If you're starting a class at 9 o'clock, you shouldn't be coming at 9:30. So I can tell my tone of voice and my volume gets higher, and hopefully they'll know that I'm mad. So these kind of things, if your tone of voice, also if you've got a patient, your tone of voice can upset them sometimes, can't they? Especially an
Of course,
elderly.
dealing with a patient, you need
Yeah,
to be a little calm.
yeah,
You need to create an atmosphere that is more friendly, so that the
yeah,
patient can actually open up to you to tell you what exactly their
yeah,
problem is.
yeah. And they feel
I
comfortable with you as well. They need to feel comfortable with you. That's so important, that they
Yes,
need to
yes.
feel comfortable with you. And you should consider the audience, so that that is the people around you. And then, engage with the reader and proofread the message. The receiver will interpret the sender's message. They will be verbal and non-verbal, influenced by their experiences, attitudes, knowledge, skills, perceptions, and culture. And the feedback in the final link in the chain is the receiver responds in some way and signals that response to the sender. Spoken comment, a long and a written message, and a smile. The communication cycle is the process. This process here we've just looked at is the process of relaying information between the sender and the receiver. And then this process begins with the sender, who decides what the message is, how they will relay it, and which medium is the best way to share the message. And, it's important to kind of use this communication cycle because, it identifies that you are able to communicate effectively and exchange information between different people and different audiences with instructions. And even if it's to healthcare workers, even if it's to care workers, patients or their families, you are able to use this communication cycle to communicate information and exchange information and instructions between each other. And the impact this impacts the health and social care provided to patients, making it extremely important. So it's really, really important. And why do you think, Vanessa, again, that this communication cycle works in the healthcare social profession?
I beg your pardon?
Why do you think this communication cycle, when you look at the receiver and the sender, why do you think this works within the healthcare profession? What are we doing? What are we trying to understand when we get a message we send a message to the receiver? What are we trying to understand? So this communication cycle, okay, involves understanding, okay, sharing and meaning, and it consists of different channels of receiving information. Also, it's a way of us understanding our audience, also to understand what is the correct terminology to
I
use.
actually hear.
Sorry, hello, she's gone off. Hello, Vanessa. Hello, Vanessa. No, again. Okay, so 1.1 We look at explaining the process of communication with health and social care organisations. The communications process is sending and receiving information. This is where the sender is clear about the purpose of the communication. Sender has an idea, information, question, etc. And the message sent is transmitted to the receiver. And the receiver gets the message and considers the information. The receiver checks and understands if necessary, consults, and then the receiver formulates a response and gives feedback and responds to the message. And here, you know, there's an element of how the receiver and the messenger will get that message across, and the idea of transmitting any sort of information across. 1.1. Explain the process of communication within health and social care organisations. And we've got the modes of communication. So it's so important when we look at written modes, where it's letters, bulletins, notice boards, updates, and newsletters. And it's so important to identify modes of communication in a letter, which is making it's like information to you, and a letter of complaint. So these are some examples of different letters just on the slides, and they identify why letters are so important in written communication, why we need to have the use of letters. Bulletins will identify if there's a need to, you know, advertise something, or a bulletin needing to go out to staff about information. And then notice boards with information on about certain illnesses, information about any sort of sessions, any forums, updates on information, and a newsletter. Hello, are you on now? Back on, Vanessa?
Yes, I'm back.
You're back on, yeah. So we look at 1.1, which is the process of communication within health and social care, and the different modes of communication. So we have written communication, which I identified as a letter. Could be letters, bulletins, notice boards, updates, and newsletters. And there's two examples there. Why is it so important when we look at form modes of communication to make, you know, why are letters so important? Why do you think writing a letter to someone is so important? Can you hear me, Vanessa?
They are important sometimes later to, for example, for official reference.
Yeah. And bulletins and notice boards, and why do you think bulletins are so important?
Because they emphasize on specific points.
Yeah, and also, you
I
know,
don't know.
sorry, what's that? It could be something, you know, about something that's on a bulletin or a notice board, something that's changed. You know, it could be any sort of new information. It's a public notice, you know, announcing any sort of things that are going on. It could be on a radio, television, or the form of like news updates and stuff and newsletters. And why do you think in the healthcare profession we need bulletins and things that have changed? Do you think it's changing all the time? Things are changing.
I actually don't. I don't know how to explain it.
No, because I'll just give you an example. Do you think like there's new changes coming in medication, in forum groups, and you know they have sessions? Do you think they all be put on notice boards?
Do I think they should do what? Be
No,
put on notice boards?
if you're talking about modes of communication, you've got things like letters, bulletins, notice boards, updates, newsletters. You know, these are important because they update the person, but not just a patient, but they update you as an individual on any sort of new medications or any sort of new sessions that you have, any forums that you have, any sort of news about what's going on in the health and care profession, any changes to the laws or anything.
Yeah,
So these,
yeah.
yeah, they keep you updated. So it's quite interesting to know you're updated, things. And if you're a patient, you want to know if there's any sort of new medications or any sort of forum sessions where you can meet other people with the same illness. It helps an individual. 1.1, explain the process of communication within the health and social care organisations. So face-to-face oral patient consultations. Why is it so important to have face-to-face communication?
Face-to-face communication actually give instant feedback. You actually get instant feedback there and then. That in case, for example, you're trying to agree on something,
Yeah,
you can easily tell. Someone may say yes, they've agreed, but when you're in a face-to-face, you can easily tell through the person's facial expressions or body language that they are saying yes, but
yeah.
actually
They mean
they are
no.
speaking something different. They are not
Yes.
comfortable with that agreement, but the main importance of face to face is that the feedback is instant. It's there and then.
And it is like, the face-to-face communication is having, you having the ability to see each other, like you said, you look at the facial expression. If you're having a conversation with someone, it's best that, you see each other during the conversation. It's an opportunity to exchange more than just words, because both the speaker and listener can observe and adjust. And the body language, like you said, and the expression is so important. Someone might be different over the phone with you, but when you see them in person, they may be different. Their facial expression, their body language, that plays a big part in face-to-face communication. Oral patient consultations, they're so important in the health and social care profession, because you are there to identify what the person is feeling, but also go through with the patient about their illnesses or their medication. So you need to be able to do that. And the next one is briefing, and this is where you give instructions or information to an individual, just before the meeting or something. And then you've got meetings which will be departmental meetings, which can be weekly meetings, team meetings. You have interviews, appraisals, and disciplinaries. So these are all forms of communication. And why is it important to have meetings within your team or within your department? Why is it so important? Do you think it identifies if there's any issues within the department, or if there's any need for extra resources or anything like that? Why do you think it's so important to have these meetings?
It is important to have them so that people can easily air out their issues. Yeah, their issues, any upcoming events.
Yeah, yeah. Any issues or any upcoming things that they need to discuss? Electronic communications, emails and text, and then telephone communication. 1.1, explain the process of communication within the health and social care organisation. So you have non-verbal communication. Non-verbal communication, sending and receiving messages without words. So these could include physical appearance, body language, like we mentioned, pictures, symbols, and drawings. Why are they so important in communication? Pictures, symbols, and drawings. Why do you think they're so important?
Because they give more visual impression just than words. I feel like they speak more, or they add on they go on to explain, or someone is able to visualize what is being said other than
Yeah.
just hearing
And
words.
it
Or
might be if there's someone with a disability, that needs to look at pictures, symbols, and drawings. So it's really important. And the whole point of non-verbal communication is the transferring of information from one person to another without the use of words and spoken language. Non-verbal communication can occur in a variety of ways, like we've said, including through facial expressions, gestures, body language, your body posture. It could be through anything like that. It could be through eye contact as well. Your voice, your touch, these are forms of non-verbal communication, and they work well in some places because you're able to identify through body movement and your appearance towards how a message is conveyed through another person. So these are really important because, like you said earlier, Vanessa, sometimes your body language will say something else and your facial expression will say something else. So it's so important that you understand this when you're talking to a client or a patient or even a professional. So 1.1, explain the process of communication within health and social care and non-verbal communication. The definition of it, other than words, is behavior. The types, like we said, we've already mentioned: body movements, postures, eye contact, hand gestures, appearance, the tone of voice, your facial expression, the importance of body language. It increases trust and clarity and rapport. And it shows that you care or not, and you are being truthful from your body language. If you're showing an elderly patient that you are caring, they're going to trust you more, aren't they? Especially elderly patients, mainly. You have that trust issue. And through verbal communication, how can you show an elderly patient that you trust them? That they have trust in you? How can you show that? Through like non-verbal communication. If someone, Vanessa, if someone is upset, what would you do to them? Would you try to make them feel? Sorry?
If someone is upset,
Yeah.
is it because of me or something else has upsetted them?
Would you try to,
is it because of me?
Sorry, what was
Because
that?
there are different ways. I'm asking because you've asked a question. What would I do if someone is upset? And
What do you think?
In order to find out what to do, I need to know if it is me that has upset them or they're actually upset because of something else. But if it's me that has upset the person, of course, I'll start by apologizing, showing them that I'm actually really sorry. But if it's not me, I would try like to comfort them, to encourage them. Yeah, and it will mostly show through my body and facial expression more than just my words, because I could actually speak to them and say I'm sorry, but the sorry is just not
words.
showing, it's not giving meaning, because my body language is not adding any meaning towards it.
So you could, Vanessa, you could put your hands around someone, couldn't you? Just to show that you care. If someone comes in and hugs you, then, sometimes, people want to hug or shake your hand to say thank you, but sometimes different cultures don't. Okay, 1.2, assess the appropriate use of different modes of communication for different purposes. So what are the purposes of communication? It's there to form and maintain a relationship between you or the patient or the client, to convey feelings, like we've just talked about that example, to solve problems, to persuade, to make decisions, to give information, and to reduce stress. The whole point of it is that you're able to, obviously form this relationship between you and the patient, or you and another worker, to identify that you're, able to, convey your feelings correctly. You're able to communicate at their level. It's so important that you're able to communicate at the person's level, and also, show that you understand what they are talking about and give them information as well. 1.2, assess the appropriate use of different modes of communication for different purposes. Also, it's there to provide information, to gain information. So any sort of information you need to give. For example, if you want to give information about diabetes, you need to portray that information to that person, be it in the form of a leaflet, be it in the form of, you know, you talking to them about their diabetes, you know, or maybe attending a forum or a diabetes session or anything like that, to generate ideas, so to generate team cohesion, to motivate. So like in a team, if you have a team meeting, you could generate ideas about any sort of new processes that are being used, how can they be used properly, and if there is a need for these new processes. To provide information formally and informally, and to clarify information, to make sure you understand everything, to progress a task, and to generate understanding. Understanding is the biggest part of it, that you understand what is being said. 1.2, to assess the appropriate use of different modes of communication, to send information vertically, upward and downward and horizontally. So it's important to, why is it so important to portray information to the individual? It might be, you know, it might be your staff member. Why do you think, if someone started new at the job, why do you think it's so important to get information through to them?
Kindly come again with your question.
Okay, so if you are trying to portray information to someone who started new at your workplace, why is it so important to help them and get through communication and get your words across to them? Why do you think that's so important?
To someone who is higher than me.
Sorry?
I haven't gotten your question.
No, if someone has started a new job with your workplace, why is it so important to communicate things to them?
If someone has hired me.
No, if someone started new, a new member of staff.
Or if someone is new at my workplace.
Yeah, at your workplace, yes, yeah.
Why is it important to communicate?
Yeah. Yeah. Why would you help them,
This one
Vanessa?
is really tough.
Why would you help someone? Why would you communicate with that person? If someone new, a new nurse
I
is
would
starting
help
at
them.
Sorry?
First of all, I would communicate with them to, first of all, make them feel comfortable and welcome in their new workplace and new job. Secondly, I would communicate to them in order for them to know the practices that we do in our workplace, giving them like more knowledge and information about our workplace, how they're supposed to carry out some duties, like general information. I think
it's important because
I don't know, but I think that
it's important because they don't know how to understand anything yet. So you help them. So to send information vertically, which is upward, sorry, and downwards, horizontally. So upward communication is lower level to higher level, and it's non-directive and non-authoritative, and it's to provide feedback and reports, complaints and suggestions. Downward communication is from the higher level, so it's a hierarchy from the directives, and it's more authoritative and it gets things done, and it's orders and instructions. So downward communication is when communication originates from the top of the hierarchy of the organization and trickles down to the bottom. So it's from let me just give you an example, from the CEO down to you. Yes, that's downward communication. Do you understand that? Hello, Vanessa, do you understand? Do you understand that?
Yes, I do understand. Yes.
So downward communication is from, for example, from your manager to you. Yes. Then you've got upward communication, and that travels from the lowest level employees to the upper management. So it could be you to the management. That's how the definition is. So downward, down the hierarchy, is an effective way of the top management to communicate with every level of organization and is also effective at sharing instructions for projects within the company. Downward communication can be used to share feedback and performance review within the company. An example of downward communication would be sharing policies and procedures within the company, ensuring that everyone is aware of the guidance they must follow, and by ensuring that information is shared. So that is downward communication, and downward communication is from the top to the bottom, and upward communication is from lower level to the top. Assess the appropriate use of different modes of communication. So methods of communication, we have oral, that's through telephone contact, face-to-face meetings, telephone conferencing, by video conferencing, and that's increased. Nowadays, there's more video conferencing through Zoom and Microsoft Teams. Why do you think that's the case now? Why do you think people prefer video conferencing nowadays? Vanessa, why do you think people prefer video conferencing?
I think.
Is it because the change after
First of
COVID?
all, I think because first of all, it is cost friendly. For example,
Yes.
if I'm unable to be in a certain country, given a certain time period, it has actually become easier for me to actually just have a video conference or a conference call with someone overseas. Secondly, I think video conferencing is more suitable other than listening to someone over a call, because you're actually able to see the person, you're actually able to communicate and share ideas more like you are together with that person. Yeah.
Video conference is being used a lot nowadays. It's because of, COVID, through COVID as well. People use video conferencing more. Written example letters, memo, financial documents, advertisements, emails and attachments, and graphical things, productive drawings and computer graphics. 1.2, the appropriate use of different modes of communication. So choosing the most appropriate mode, so it depends on the reason. So why it's so important, you would use a written form, the recipient might use an internal, external, the technology available at that time, internet is a big thing. Sometimes the internet goes off if you're in a different country, and the timing as well. And, the IT resources that are available, they may not have a laptop. Also, the urgency of the message, how you send a message across, either courier or through emails, things like that, identifies why the message is so urgent. So it needs to be sent through forms of, external or internal. The complexity of the message, whether it's very complex and written, whether instant feedback is needed. So if you send a message to someone and you want instant feedback, what would you do? Would you send a letter on an email? If you want them to instantly, if you want them to instantly respond and give you feedback, would you send an email or a letter?
An email.
Email. Because, they will sometimes respond back in 10 minutes, 20 minutes, but they will respond back quicker than a letter because you're sending that by courier. 1.2, assess the appropriateness use of methods mode for different purposes. Limitations. So oral is unsuitable if the matter is to be communicated is lengthy. It lacks recorded evidence for future reference, and it does not allow the listener much time to think, act, and react. Now, by video, there's some limitations. It can be harder to focus. There may be time delays between responses. And like we said, the technology can fade and audio quality is bad. So if the technology fails, it's hard to carry on with this video recording. Written ones, it's impersonal, possible miscommunication due to understanding, and lack of instant feedback and slow. Sometimes, if I get a letter or if I get an email, sometimes it comes across as miscommunication. Have you ever had that sometimes, where you've got an email or a letter and it's comes across as, you know, a misunderstanding of what the letter means.
Yes.
Yeah, it may mean something else, but it comes across as not you understanding it. Graphical, so the cost can be expensive, time-consuming, insufficient, and incomplete, so all information cannot be presented at once. So today we've looked at explaining the process of communication within the health and social care organisation, and we looked at assessing the appropriate use of different modes of communication for different purposes. So we looked at letters, bulletins, face-to-face meeting, non-verbal communication. They were the different modes we looked at today. These are some of the references that we've used that you could go on to and have a look at this. Okay, so looks at disadvantages and advantages of video communication. And we've finished today's session. Okay, so today's session is finished, and have you got any questions on today's session, which is learning outcome 1? Vanessa, have you got any questions?
I don't have questions. I just have a request. I just need the work on our Moodle platform to be updated. Like, I don't know if you're going to do that. I don't know if you're going to share the presentation with updated work.
No,
It would actually be nice help for
these presentations. Every time we do some presentation, you should have access to this, and you will get the recording. We don't update it.
But in my previous session, I realized that most of the work was updated, and it became very helpful for me because the work that I found on my Moodle was really lacking. Really helped because the presentations were actually updated. More work was put there, which really became easier for me compared to what I found on the platform.
These presentations are what you are discussing and what you are doing now. When it comes to doing your assignment, you need to do extra research. These are the presentations I've been given to work around. There's nothing updated on these. These are the new presentations. These are the updated presentations. So you need to, you know, if you need to put extras, you use these resources and then use other sources to put extra work in.
Okay.
So these are the ones that we've got for each session. I've got different slides for each session, and them are the slides that will be used. And then we'll do discussion around them. But there won't be any sort of additional information. The additional information will be available for you on Moodle. But there's not any sort of additional information that I can give you in regards to that. So there'll be more discussion, and you'll need to obviously listen back to the video in regards to the discussions that we've done.
Okay.
Okay. So if there's any questions or anything you need to ask, I'm always here for you to ask. When it comes to your assignment, you know, we'll kind of get you around doing what you need to do on the areas that you've got to do in your assignment. But these will mainly help you to complete your assignment, each learning outcome. Okay?
Okay.
Have you got any other questions? You've got a session tomorrow as well at 10 o'clock. Would you want me to contact Jill for you? What would you want me to tell her?
Maybe let me first look through my schedule again, then I'll communicate.
Okay. Yeah. So would you contact them yourself, or if you want me to contact them, it's up to you.
I'll contact them by myself because I'm normally in touch with them.
Okay. If you want, you know, we could speak about the extra sessions. I can do tomorrow's session. I can do a couple, and then the other Sunday I could do a couple extra if you want to finish early.
Okay.
Okay, but you need to get back to them. Okay.
Okay.
Thank you for attending today's session.